Hi everybody, this is Kevin with Garrison Dental Solutions, and we are here today with the esteemed Dr. J.D. Corey.
Oh man.
Yeah, no pressure there, no pressure there. And Dr. Corey has helped us along through the process of developing the new Fusion Anterior Matrix System. We've gotten you prototypes along the way, and you've been shooting videos and really helping us develop this product. And I think you were the receiver of the very first. In fact, I don't even think we put a label on it.
No, there was no label.
it was hot off the press. Right. I mean, it came off the machine. We put it in a box and ran it over to his office.
And I started using it right away. So.
Yeah, and that's what we wanted to talk about. Now that we've put the final finished product in your hands a little bit,
yep.
And you've had a couple of weeks to work with it. We just wanted to talk through maybe a couple of the different use cases that you found, indications, maybe contraindications of use, and make sure that we're representing the product properly.
Absolutely,
and telling people how to best use it. So far, in your experience with the Fusion Anterior System, has there been any cases where you felt like, I don't want to use that. I want to go back to a Mylar or a different type of product?
I've been fortunate enough to have the opportunity. I've been using this product on a lot of these anterior restorations that I'm doing, and I'm loving it for the most part, and I want to use it every chance I get, but there's been one situation where it just didn't work for that specific tooth that I was working on. I'll kind of explain that. It was distal of a maxillary canine. And so it's kind of like a distal lingual facial restoration, kind of wrapped around the tooth. And here I'm looking at this thing like, okay, this is going to be, a challenge to restore. Hopefully I can use this new system that I've been having a lot of luck. My restorations have been pretty easy and just nice margins, and everything's been going well. So I was excited to try it. It didn't work out so well. And I think the reason is that distal of the canine of the tooth I was working at was really curved.
Okay.
Kind of, from an incisal, gingival direction, had a lot of curve to it. And so these bands are set up more for, the interproximals of 8 and 9. It's more of a straight interproximal restoration, and that canine is more curved. And so I tried to use it for the restoration, and it was just, even with the wedge in there, the tooth ended up looking more straight than curved.
Okay.
So
sure.
That was the one area where I had trouble using it. Now, you're going to have some patients whose anatomy, they just have those straighter teeth, and in that situation, I think you can use it no problem. But I had a challenge with that one, and part of that was probably too because it was just such a massive restoration, really probably needed a crown. That situation was tough.
Yeah. Now, you were mentioning a little while ago about that you've been finishing up a lot of clear aligner cases lately. Tell us a little bit about that.
Yeah, so we do a lot of aligners, and specifically, the lower anteriors, I've been using this product at the end of the aligner cases. And what happens is we'll have this patient who wants to do aligners, and maybe they've had, just wear on their anterior teeth from the way their bite comes together. By the time we finish the aligners, now their teeth are nice and straight, just like it would be with any orthodontics. You get their teeth where you want them to be, but they still have the wear pattern from the previous occlusion built into the teeth. So what we'll do in a lot of situations is kind of, instead of just grinding the teeth off to the lowest point and making them nice and straight, if the situation calls for it, where maybe you have a tooth that sits a little low or a tooth that's kind of worn at an angle, we'll build those teeth back up, usually with composite in that situation. And this product's been really helpful for that, kind of building up, especially when we're doing, something that requires building up the mesial, distal,
Sure.
Facial, lingual, everything.